Hello again, good evening. That was really awkward. Sorry. I still am having trouble introing these videos. I think I'm gonna have to start to do more of like a vlog type style because this is really awkward, just sitting down and talking to a camera with this big light in my face because it's evening right now and I didn't have time to do this video during the light of day. So stay tuned for hopefully a change up in the way I'm doing these videos so that they're a lot less awkward for the intros. It happens every time. Anyways, as you can see from the title of the video, I wanted to have a more of a serious chat with you guys about the lesser talked about kind of side effects from endometriosis or really any kind of chronic pain or chronic condition that ends up changing your life. And those side effects of the disease and everything that surrounds the disease are addictions and mental health issues as well as suicide. And this is something that, like I said, people aren't talking about really. There's still a stigma behind all of this. There's still a shame associated with this, and it needs to be talked about more freely. We need to have these conversations with our doctors as well. Our doctors really need to be initiating these conversations. So let's just get into it, starting off with mental health as well as suicide. I did touch base on this topic in one of my previous videos. I have been struggling quite a bit. Things have just changed in my life and I'm not accepting it very well. There is no cure for this disease. Treatments are hit or miss with people. I've had some success with it, but not a lot. I am on Orlissa currently, but I still have pain every day. I'm still really tired for the majority of the time. It's a dark hole. I cannot see any light in any direction. I try to be positive, but at the same time, it really hasn't gone well so far. So why would I think that it's going to go well into the future? I cannot see a way out, and I think this is with many of you, and many of you have worse issues than I do. And because this disease is also invisible, meaning it is internal, anything internal people don't seem to validate. They think that, you know, if you have a broken arm or something that's visible to the outside world, it's validated. They accept your disease, injury, condition, whatever, if it's visible, but it's not visible. So I may look perfectly healthy, I exercise, I eat well, you know, things look good from the outside, however the inside is a mess. So it's hard to cope with that being kind of pushed to the side. Like most of us, it takes like at least 7 years to get a diagnosis for the most part. And it took me till I was 30 years old to get a diagnosis when I have been dealing with this disease since I had my first period. So it's really disheartening when you have this disease and you're just being told, no, you're fine, no, you're fine, no, you're fine, or you finally have a diagnosis, but it's still, they're not able to help you, so it's still, you know, oh, it must just be in your head, you gotta think positively, whatever. Yes, that does contribute to things. Thinking positively, going into a new treatment with a positive outlook on it, trying to uplift yourself definitely helps your situation, but this is not the be-all and end-all. If you have pain, you have pain. This is where the mental health aspect and the suicide comes in, is that you're just being fed all of this, like, all of this information that what you're feeling is not real, or that you're not being listened to, and it's very frustrating. And the suicide aspect comes in when you cannot see an end, like I had mentioned before. You cannot see an end to the suffering. This is where people lose hope. This is where people realize that they maybe can't do this anymore. They cannot continue on knowing that there is not an end to this, that they have to go through the majority of their life in this pain, and there's very little resource and very little help for us, and the research is really minimal. I think a lot of us feel the same way. I did read a statistic, I'm just going to read it off here. A survey done by Endometriosis UK stated that 25% of women with endometriosis have contemplated suicide. I think that number is low. I think a lot more of us have contemplated it and maybe just not mentioned that. And in the study that they had done, I would think that some of us maybe just didn't feel comfortable enough saying it, because I can see a lot of us having those thoughts. So I have definitely had thoughts of, I cannot do this anymore. I physically don't have the strength to continue to fight this disease and to keep going. I tell my significant other of my thoughts so that there's always somebody that knows what I'm thinking, which is huge, because if you keep it to yourself, it's even worse. So get it out there, tell somebody, even call the helplines, anything. I'm going to put the numbers up for the Canadian health line. I'm not sure I think it's suicide prevention line, as well as the US one on the screen here, just in case any of you are feeling the need to talk to somebody and you don't feel like you can talk to a family member or a therapist, or cannot afford those types of resources either. You need to talk to somebody about it. That is number one. Telling somebody how you feel, having somebody validate the way that you're feeling is huge. And another aspect with the suicidal thoughts and mental health is that most of the medications that we are prescribed for endometriosis, the side effect is suicidal thoughts, mood changes, depression, anxiety, that sort of thing. So not only are we having a struggle with mental health because of the disease and because of the chronic pain, also what we're being prescribed for management of the disease is also contributing to this. So I'm sure a lot of you too, even just when you were first prescribed a birth control pill to try to control your period pain, that was number one side effect for me. I was just more numb to feelings, and I did have a lot of mood swings as well, especially with certain types of the birth control pills. They would make me like rage. I would feel out of control. And that's just the birth control pills, let alone all these other medications that were tried on, and the being put into menopausal state with either the Lupron or the Orilissa medication. These also have those side effects. I'm going to move on to the addictions aspect. So lots of us are prescribed opioids for the chronic pain. For myself, the opioids didn't even get rid of my pain. It was just in order for me to sleep. This is another hard aspect of having this disease, is the extreme exhaustion. And then I don't know about you guys, but I seem to wake up at like 3 o'clock on the dot every single night from pain. And if I'm not taking any pain medications, this is the case almost every single night. And you can completely see how somebody would get addicted to this. So I would get into the kind of cycle, and this is kind of when I knew that I maybe needed to take a break from this medication, is I would get anxiety over if I did not get my pill, I was not going to be able to sleep, which is true to some aspect, but you know, you can see the cycle. And when you miss a night of sleep and you have endometriosis, you are completely exhausted all the time anyways, and then you don't sleep well. It's really difficult to manage your day-to-day life. Personally, I have gone through 2 withdrawals I was on Dilaudid twice, and the withdrawals are really horrendous. I'm sure some of you have experienced it as well. You have body aches, you have cold sweats, jitteriness, super anxious feelings, cannot sleep. I didn't sleep for about a week when I was coming off these meds, and you can see why somebody would just be like, oh, forget it, I'm just going to take some because I cannot handle this anymore. I am fortunate enough that I have kind of controlled how much I'm taking and recognized when I was upping my dose a little bit too much that perhaps I needed to scale back, as well as maybe stop taking the medication, get it out of my system, and then start back up on it if need be. It's really no surprise that we do suffer with addictions with this disease. It's hard enough to deal with, and then if you get any sort of relief, you kind of cling on to that relief just to try to live a bit more normal of a life. I did also want to mention something about how we are treated when we do get opioid prescriptions. It's really hard to take somebody that is not an addict being treated like an addict from the get-go. As soon as I got prescribed opioids, I was treated a certain way by my pharmacist, and it ended up in me changing pharmacies because I was so uncomfortable every time I went to go get my refill of prescription. It was this looked down upon judgment from them, and I just didn't need that. You know, we deal with enough. I know it's their job, but they could do a lot better at not looking so down on somebody that is taking this medication. Another thing that we deal with is that shame of feeling like being an addict for just, you know, trying to live a little bit more of a comfortable, normal life. I think that concludes everything that I kind of wanted to touch base on today. I am seeing a psychologist at the moment, so I'm hoping to get a little bit of guidance in how to cope a little bit better and how to kind of persevere everyday life while still being in pain every single day. So I will keep you guys up to date if I have any kind of tips from her on that, or if I've learned anything. And again, if you guys are struggling with any of these, please go to see your doctor. See somebody, call one of the helplines, do something, tell somebody, because you are definitely not alone. There are so many of us out here. We are here to support you. If you do have anything you need to talk about, please leave anything in the comments. I would be happy to respond to you. I just strongly encourage anybody to seek out any help that you can, in any way that you can. Family members, doctor, helpline, anything. Thank you guys so much for watching. I hope this helped. I will see you guys next time. Bye.